One.
Hey, everybody. Welcome to the Daily Objective. And today we've got a topic that's quite interesting. We're talking about the opioid crisis. Now, normally I try to disclaim every topic and say, I know nothing about this. Please take this as an exploratory episode. In this case, with 9.5 years clean, I think I have a little bit to offer on this, although maybe at a societal level, my opinion doesn't count to too many people because we like statistics, we like, expert opinion. So it'll be interesting to explore this topic here today. We have, well, first off, my co-host, this is a guy who I don't know if he's done opioids or any drugs at all, but he works in an industry where I'm sure he's seen many lives ruined by drugs, as well as many lives elevated and improved by recovery. Actor Mark Pellegrino.
Hey, Rucka, how you doing?
Pretty good. Drug-free, I'm happy to say. And with us, we have a guy who, well, we haven't drug tested him personally, but he recently wrote an article about the opioid crisis, and he is affiliated with the New York Daily News, or the article was published by the New York Daily News, for whom he freelances. Please welcome Peter Pischke.
Thank you. I know I don't have too much experience with illicit drugs. I'm Mormon. So not a lot of alcohol or drugs growing up in my life. And then as an adult, my pancreas was shot. So that was just not on the cards. I will not get to experience that in this lifetime.
Well, I don't know much about pancreas, but I do know when somebody's addicted and when somebody has the will, they find a way. So health problems have never stopped people from getting their fix. But I just find this so fascinating. Like we were just saying before we began the episode, I'm looking at your Twitter and it says disabled otaku, which I happen to know from my research. Otaku is an anime fan or enthusiast or something like that. And the fact you're Mormon on top of that, and you're an actual like real life working journalist who is publishing with real publications, the world has become a very interesting place. Welcome to the show.
Thank you. No, if you had told me a month ago, I would be on here with the guy from Supernatural, I'd be like, no way. My family loves Supernatural, by the way, so I'll try not to geek out, Mark. But yeah, it's a pleasure to be here. Thank you.
Nice. Don't tell them that Supernatural is better on opioids. I'm joking, of course. Speaking of staying off of drugs, please everyone super chat us. Looks like it's working again. We need the money. It's been broken the last couple of days. We've been starving. We will not spend your super chats on opioids. But if you hold on to that money, statistically, you are possibly going to spend it on opioids. Statistics speak, right? So be logical, folks. Send us a little bit of money, support the show, and consider becoming an Ayn Rand Center UK member to help us grow as well and to get exclusive content. Now, enough of all of that. Let me ask you, Peter, what is the gist of your article, if you had to summarize?
The gist of the article was, so most people who understand the opioid crisis, they probably have read from the newspapers or they've seen a movie or documentary. They think it's about prescription drugs mostly. That's the way it's been framed. There was this idea that the needs of those with addiction problems and the needs of those that might use opioids are actually against each other, that if you take care of one population, that means necessarily that you will have to neglect the other one. That was kind of the general consensus going on. Of course, 2016, the CDC put out the opioid prescribing guidelines. And people thought, well, if we just go down hard on prescribers and doctors and patients so that they can't access these prescription drugs, that'll fix the problem. And what we found out is we're getting studies almost weekly that show that that was not the case. And actually, by taking this top-down method of trying to deal with the overdose crisis, it's making everything worse. Addiction rates are up. The amount of people who are dying from overdoses is exploded even before COVID, and COVID did not help. And for this cost, we have millions upon millions of patients, people who have cancer, people who are disabled, people who are veterans, et cetera, who have been abandoned by their doctors and forced tapered and no longer can access effective pain treatment. So, I mean, it's a giant clusterfuck, and the CDC knew it. and the CDC was going to do something about it. And then the CDC, something changed there. And then the new guys at the CDC got in charge. And I'm like, we don't want to take any responsibility here whatsoever. Are you kidding me? So it's unfortunately a very tough, a very sad issue. It affects so many lives so intimately in so many different ways. And the behavior of the CDC on this issue is pretty bad. It's pretty heinous. And there's not really much excuse for what they've been doing.
What do you attribute the rise in opioid addiction to, is particularly after the federal government has come down on it, and the rise of addictions, the rise of overdoses? How is that possible? Since their logic is, well, if we restrain the market, then clearly we're going to cut down on users.
So I'll get to the addiction part, separate that out just for a second. Drug use in America is just a little higher than other nations. This was originally attributable in the 90s. We started really pushing effective and full pain treatment. It was an overswing from most of the 20th century, which, if you remember, there was alcohol prohibition in the 20s. Well, there was an effective opioid prohibition for most of the 20th century. In the 80s, when they're looking at ways to reform healthcare, and this is still true, it's been this way since the 60s, the third leading cause of death in the United States is medical error. So there was a movement to try to reform medicine. It was at this point they looked into and says, okay, we should try to bring pain medicine back using opioids. Well, in the 90s, OxyContin comes out, and the general consensus was at the time, and people aren't totally sure yet because you can only study these things really by working with patients directly or arrest reports, that OxyContin spurred people to become addicted to opioids because it was easily accessible. We're not totally sure what was going on there. There are mixed studies that say both ways. Family breakdown definitely has an effect. The rise of mental illness, health problems, that all adds to it. A poor economy, of course, feeds addiction. As you guys know, people who don't have a lot of things going on in their life, it's easier to feed those problems they might have. The overdose, though, the overdose, we know for sure what caused that. That was the Obama FDA. Because in 2009, they had this amazing big think idea. They were like, okay, so people use OxyContin illegally on the black market to make what was basically the poor man's heroin. It's not heroin, but that was, they would crush it, put in a powder, mix with water. They got a gel-like substance, and then they would go with that. So the FDA said, okay, so if we make it impossible for people to use OxyContin to make their cheap drug, that means people just stop using drugs, which is a crazy approach, as all of you know. You're like, no, that's not how that works. But that was their idea. They forced Purdue to do it, and that became the ignition for the overdose crisis, because you have all these people who are using drugs, full-on addicts, casual users, whatever, and now you're pushing them to much more dangerous substances like heroin. And at the same time, fentanyl comes in because it is dirt cheap. It is very powerful. You do not need very much of it to get a high or get killed. For example, in my local paper last month, they put out an article, biggest fentanyl bust of all time, 1 gram. It doesn't take very much at all. And so people, they're pushed into using more dangerous drugs to get their fix. And then we have these more dangerous substances becoming the mainstay in the illicit drug pipeline. And it was just the worst of all worlds. It was just a bunch of things coming together at the same time. And so you have all these people with addiction problems and first-time users say, I know a lady, her kid, not a drug user, but they had a test. They were stressed. They wanted some what they thought was retinol. They get it. It was laced with fentanyl. Unfortunately, it kills the young woman. It is a terrible situation. The attempts to try to fix it have been almost all top down. None of them, as far as we can tell, are working. And it looks like currently the people who are going to be in charge of these problems in government and the major health institutions, they haven't learned that lesson yet. And it's unfortunate.
What is the lesson, or what is the solution if you could wave a magic wand?
If I could wave a magic wand, my understanding is that to help those who have addiction issues, and to help those who have pain issues or any other health problem, you really have to take it on an individual basis. I know that seems really basic, but right now we're trying all these ideas where we want to take people and we want to fit them in a box. The solution is you have to fit it. And that doesn't really work, especially in healthcare, where in this huge country of ours, there are so many disparities and so many things going on, so many people with so many different problems. A top-down, one-size solution does not really benefit hardly anyone except the people who have to, the providers, the healthcare insurance, the hospitals, the pharmaceutical companies, et cetera. What would work best is that we went back to this idea that people have individual needs, individual situations. One man, even, one man that has an addiction problem, their problem is going to be different than another person's because they are an individual and they have separate issues. And that's the way to do it. We go to them, we say, let's work with you, try to find what's the best way to help you, your needs, your situation. Let's work with you on it instead of trying to, round block, square hole it. It doesn't work. I mean, that's no longer just an opinion. The stats we have show this strategy is not working. It is only making things much worse for everyone.
Well, it doesn't seem like the government has the capacity to individualize treatments like that. So are you implying that they should take their hands off the steering wheel a little bit?
I mean, I guess like in a way, long-term, yes. It's healthcare in the West is extremely bureaucratized. It would be a very difficult thing to do that. So the approach I've heard from people who are opioid moderates is let's slowly change this up. Let's slowly move on. Let's not try to lose the lessons we may have gained about fighting addiction. But at the same time, we need to make it clear that people who are patients are able to access help too. And by the way, it's not just a patient problem. You guys might be aware in the US, it can be very difficult in some parts of this country to access effective treatments for addiction, Medicaid assisted treatment, et cetera. A lot of places are still using a very much older model that is much less effective. I mean, and it's well-intentioned, but the results aren't as solid. So for both sides that I've talked to that report on this issue, they're pretty much agree that we need to try to get smarter and get a little bit freer on this issue.
By the way, thank you, Mary Aline, for the super chat. Go ahead, Mark. Do you have something?
Well, no. It just seems that because people who are in genuine chronic pain will be suffering more because aren't they limiting prescriptions now? Like I heard a friend of mine who's in chronic pain. They gave him three times to be able to refill a thing, and that's it. Mm-hmm. And this is a guy who lives with pain his entire life. And if it comes to a choice between, from my own perspective, being addicted to an opioid or being in terrible chronic pain that incapacitates me, I think I'll be addicted to the opioid so that I could have some quality of life. And if that is the case, that is my choice. I definitely feel that the government is clearly making things worse by clamping down the way they are. And it seems to be making things worse for people who are in sincere, genuine physical pain.
No, you are exactly right. And if COVID had not happened, this would be the defining health issue of the early 21st century easily. The impact is profound. It is profound. I've got a little burnt out on this emotionally, if I'm going to be a little bit honest. I was talking with someone the other day, they're sharing their story and it got to me. I was like, whoa. It's like, oh yeah, it's so heavy and so hurtful. Millions of people have been hurt by this. The CDC, the FDA, they are only starting to begin to count patient abandoning and tapers. We're not sure what that's going to look at, but we know millions of people have been affected. For example, here are just a few stats. We know that there are roughly 50 million people with chronic pain at some level that require treatment. At least 30 require an effective treatment. So it's OxyContin, okay, for example. We know about 87% of general clinics and about 80% of all pain clinics refuse currently to take in new pain patients. They just said, it's not worth it. I can't take you in. I'm sorry. The Stat News has covered it. There's a very high percentage of people who have cancer, even late stage cancer, who are told by their doctors. And I know this because I met with dozens of these people. I can't take the chance you're going to addicted. doctor, I have late stage bone cancer. I'm not going to survive a month. What is this? He's like, I'm sorry, I just can't deal with it. I can't deal with it. And the doctors, they look, people who go into medicine mean to do good for the most part, but it is a huge, the amount of work, effort, money that goes into it. A doctor is not going to put his license, and it's sometimes putting his self in danger. He doesn't want the media on top of him. He doesn't want the state medical boards saying he's a bad doctor. It's just not worth it to him. And so many amazing doctors who have generally been really great in taking care of their patients all of a sudden become cold. There was a friend of my family I just talked to that through my mom. She's a nurse, so we know their family through there. The guy was on opioids for 50 years of some sort. He was on Oxycontin since the 90s. His doctor now tells him, well, I can no longer help you because I do not treat long-term chronic pain. And then he's like, wait, but what were you doing all this time, doc? It's crazy. It's crazy town. And if you don't believe it until you read it, in the UK, which has followed our lead, they just said literally yesterday, if you have illness that cannot be easily diagnosed, identified as something, so it fits into one of those categories like diabetes or whatever, you are not supposed to get pharmacological treatment for your pain, period. And the amount of people that they want to fix this issue by just, it's not working yet, let's tighten it some more, guys. We'll get it eventually. And
so you got to,
it doesn't work.
You got to figure that person with bone cancer, which is probably got to be one of the most painful cancers out there, is going to turn to the street, to some street dealer to get some drug to relieve his pain. And there we have overdoses, potential overdoses and impurities going into the drugs. That's awful. I mean, this is just a clusterbuck, as you said, a total clusterbuck.
It is heartbreaking. It burns a lot of people out. People don't understand why they try to bring this issue to the media or to the AMA or the ACLU. And thankfully, the AMA did eventually take it on, but they have been quiet lately. And we're hoping that isn't going to stay the same. But look, people, we live in an era where in journalism, and I've experienced this, I'm sure you guys know, the narrative is what is supreme. There's a storyline we're going with this season, guys. That is what is important. And if you have contrary evidence, we might give it a little attention personally, but we don't really want to talk about it. We don't really want to spread it around. And people are just not on this issue yet. They are still stuck on J.D. Vance, who is a lovely guy, but that version of how we got into the crisis, people are still stuck on that. The media is there. There are 5 different movies and documentaries right now, either on major streaming services or in theaters, that push the addiction crisis narrative. And look, addiction is real. No one is debating that addiction doesn't exist. Well, no one that's serious. But we've tried this way. We have tried the top-down approach. We have tried strangling people from the medicine that they've been on perhaps for decades, and which, by the way, they obeyed the law and the FDA and the VA and all the rest recommended back then. And they don't, this is such a whiplash. It's so destructive. It really burns you out. It really does. You're like, for a while, I was trying to help people. Like if they lose their doctor, we would, and this is, if you guys hear this, there are a lot of pro bono people who call themselves advocates. And most of what they do is people lose a doctor. Let's see if we can find another one. People are suicidal. Let's see if we can do a mental health check, et cetera, et cetera. And I engaged in some of that because people had approached me for help. I remember one person we were really struggling with because he became very, very suicidal. And I mean, at one point he was emailing me and sending me pictures of the black tar heroin he had purchased and was now using. And that kind of story is not uncommon. It is not uncommon at all. And one day, history or journalism or somebody's going to catch up to what's happened here. We are going to get the full stats, and people are going to be like, what the happened here? Like, what were you guys doing? Why weren't you paying attention? It's just going to be one of those things we look back on, like eugenics or Buck v. Bell, or doing unlicensed medical tests on African Americans. I'm drawing a blank right now. that kind of stuff we all cringe and
anime.
horror, and this is just going to be another one.
Yeah. Maybe they'll look back at anime and say, what were we thinking? I'm joking, of course.
Oh, no. Anime is going to be supreme. That's what you don't understand.
You're right. They're going to say, how did you watch anything other than anime?
That's right.
But so as you can tell by the way I introduced the show, I approached this topic from the topic of addiction. Do you have any? But it sounds like there's quite a lot of people who they're dealing with actual pain, physical pain. They're getting painkillers or some type of medicine that helps with the pain. Do you have any insight on like how do we separate these two groups of people? Because the problem is very different, and the solution is in my opinion, going to be very different between a person who's been getting high since they were a kid. And to them, that's like a big part of their life. And they've been using drugs and alcohol in a very spiritual type of way. Whereas someone else has just been a non-addicted, law-abiding member, tax-paying member of society their whole life. They got sick. They got addicted to opioids they got prescribed opioids. And now there's all types of problems.
Yeah. Mm-hmm. Yeah, no. And I mean, the stats we have for opioid addiction, starting with prescription opioids, is very slow. But, in a country of 300 million, even at 1% addiction, that is still a lot of people. So we shouldn't, sometimes people who are on the chronic pain side of the issue kind of want to marginalize what's happening with addiction. And that isn't right either. I think I've definitely learned that now from studying the issue and meeting with people. Look, addiction is very difficult to deal with, as you guys know. There isn't a clear delineation between dependence, so that's your body physically needs it to live your life, and addiction. It's very complex. Addiction is made up of many things: mental health, physical health, family life, just freaking random chance. There are so many different factors that feed into it. So it is a very hard issue. I think some of the things we're seeing that work are like making buprenorphine, Suboxone available for people, making sure we have naloxone available if people overdose or need help. I think detangling some of the stigmas that are against people that have addiction problems, I think probably is effective. To be bluntly honest on the science of addiction, even more so than pain, we are very much in the Stone Age and what we can actually do to help people with the issue, which is not something a lot of people want to admit to, but is definitely the truth.
No, I agree. I think psychology as such is in the Dark Ages, or the Stone Ages is an even better way to look at it. We are cavemen in that respect. So the day that people understand their inner world as well as they understand, the physical sciences, I think Ayn Rand, the namesake of this network, put it that way. Like when if men understood their inner world, like 10% as good as they're able to deal with the external world, we would see enormous progress. Something like that. I'm obviously paraphrasing. Marilyn in the super chat with $5 says, "What I hate is that Pharma gets blamed instead of government." Yeah, big Pharma and the companies who produce and sell these drugs. It's always their fault. It's their fault when there's not enough access to it. It's their fault when people are hooked on it. Somehow it's always the businessman that gets blamed.
Well, if I could speak just a tiny bit to that, this may interest you guys. So Pharma does play a role. It's not like Pharma isn't unethical. But the problem is the rules that the Pharma plays by was set by government, often with Pharma's input. And they're supposed to be the people who look over this. One of the things that Jacob Solom, he's kind of like my mentor on drug reporting over at Reason. Amazing guy. If you guys ever need someone that was even smarter than me on this issue, he's the one. He has noticed, he's put it, that when they actually see these big companies and they are taken to task, taken to court for their bad practice, two things pop out. First one is their bad practices are virtually the same practices used for any other pharmaceutical and any other pharmaceutical company. Yes, it is unethical, but that doesn't mean it's illegal. And you have to have a specific statute to point to. And so when these companies are taken to task for enabling the opioid crisis, they usually are unable to cite too many statutes that aren't really serious. So instead they go with general nuisance like they did with tobacco. But people still want to blame them. And some people are even foolish enough to believe this idea that if we take these companies and we shake them for their money, that money is going to come down for addiction, not be eaten up by the lawyers, by the general budget, and all the rest. That's really what's fueling the narrative side, but it's just not going to happen, guys. It's such foolishness to expect that. It goes against all we know about how litigation and government works.
Well,
So
what are they doing? What are the drug companies doing that puts them at the head of responsibility, aside from producing the drug?
The argument goes that Big Pharma, so like OxyContin, when you first came out, it was put out originally as a medicine that was a pain medicine and also long acting, so it could go 12 hours. Not soon after it came out, Purdue figured out that it doesn't last that long, maybe at first, but after continual use, that window goes down substantially. They would advertise to doctors. That used to be okay. My dad is a PA. He would get random crap from pharma companies all the time. Like we have a Zithromax zebra puppet hiding somewhere. I have to pull it up. Just really random stuff. And they feel that the pharmaceutical companies know these things were addictive and they pushed them anyways. But again, it's more complicated than just that. And they have to break the law. And the government's the one that said, we want you to get this medicine out to people. We want you to treat pain as much as you would for any other vital sign. That's what's called a fifth vital sign. And doctors were getting their livelihoods ruined, getting huge demerits from their hospital system because they weren't using enough. So there's just a lot of people forgetting the history here. It's much more convenient if we go with the narrative than it is to admit that for much of this, a lot of this is self-inflicted.
Interesting, yeah. Because I just feel like a company pushing its product and doctors desiring to make their patients more comfortable after painful procedures, or just even more comfortable because they're terminally ill. It doesn't sound like such a bad thing to me. It feels like addiction is an individual problem, even though there are somatic issues, right? The drug itself links to your chemistry in such a way that it makes it very hard to get off of. You have physical symptoms if you get off of it. You can still get off of it. It's still a matter of will, right? It's still a matter of overcoming. It's still a matter of your own. It's not necessarily the pusher's fault, and not necessarily the pharmaceutical company's fault or the doctor's fault so much. If one is addicted, that's sort of your responsibility, is it not?
Yeah, and that, of course, is the problem in every major story these days in the West is everything, because we're not automatons, on every issue, there's always at least a nugget of responsibility. And that no one has the guts to say that. They're like, look, your situation is horrible. What happened to you is horrible. It's tragic. It's awful. It's bad. It's terrible. But you did play at least maybe even a little bit, a tiny role. Dr. Sally Satel, who is she's amazing. She writes and talks about this stuff all the time. And she came from the addiction side, but she's virtually a chronic pain expert at this point. She actually moved down to Ohio, to where one of these pill mills used to be. And she talks about that. She would meet with the drug counselors and they have the 12-step and you have all these guys in the room and they have addiction problems. For this group, it was alcohol and opioids. And the guy would say, everything's happened to me. It's not my fault. It's because my doctor gave me the opioids and he didn't watch out. And then the counselor says, oh, that's right. Your doctor, he prescribed you oxy, then crush and snort. And then all the room laughs because they know it's bull crap, because they know that they do have some agency here. And it's tough. Look, addiction is a terrible, terrible, hard thing. People who struggle with it, it feels like a demon on their back, and it's horrible, awful, terrible. But punishing the pain patients is not going to fix it. And
that's for sure.
We are just about out of time. Thank you, Bonnie, for the super chat. She says, by its nature, government can't fix this problem. It caused the problem. It's a vicious cycle. All of it's a vicious cycle. Ultimately, the only solution, to the extent there is a solution, I think, is philosophy, is to change the way people think about fundamentals. And I would say the only way to really bring about that kind of change entails individuals looking at the world and asking, how can I maximize this finite life of mine? And that's the type of thing we try to promote here at the Ayn Rand Center UK. So maybe someone out there is dealing with an opioid addiction or an opioid dependency. Maybe confronting that issue will be the mechanism by which they become open to new philosophical ideas about ethics, about epistemology, and of course politics as well. Thank you all for the super chats, for the involvement. Riley in the chat room said his favorite Pellegrino movie is Big Lebowski. I didn't even realize this whole time, Mark. I just Googled it. You were the guy who dunked Jeff Bridges' head in the toilet. That is legendary. I imagine finding out. Imagine finding out you are in the presence of legend. Anyway, we are jumping over to Clubhouse. Thank you, Peter. This was fantastic.
Thank you so much for having me on. It's my pleasure.
I don't like to stereotype, but I've never met a Mormon who I didn't like. I mean, what is it with you people? You guys are
super. Well, I gotta say the same here.
Yeah. Let's all just be Mormon. I feel like I would have to give up my tea, but maybe the opioid crisis will get solved in the midst of that. Anyway, enough with riffraff. Time to jump over to Clubhouse. We will see you all there, and we'll be back here tomorrow for the same time on the Daily Objective. Thank you and goodbye.
Thank you.
Thank you.